Hey guys, it's Dr. Danielle Cooper, Dallas plastic surgeon. So a common question that I get is if there are any non-surgical options for removing extra skin. So the short answer is no, not really. It does also highly depend on your anatomy. There are some people who have a little bit of loose skin, but not really an excess of skin per se. And so those patients would benefit from doing other non-surgical modalities like energy devices. Some of those energy devices do require you to still have some type of anesthesia, and it still might be considered a surgery, but there are other radiofrequency devices that are out there that don't necessarily require you to go under anesthesia. But those produce very modest tightening of the skin, which might be beneficial for somebody who really just has a little bit of laxity, a little bit of looseness, but not really an excess of skin. Now, if somebody has excess skin to the point where the skin is hanging over, it creates a fold, then the only way to get rid of that, honestly, is by cutting that skin out. So what happens is as skin stretches and as we age, we lose the elasticity in our skin. So there's collagen and there's elastin fibers, and that helps to create the structural architecture of our skin, and it gives the skin its ability to recoil, particularly those elastin fibers. Now, as we gain weight or lose weight, so significant weight loss, even things like pregnancy, because you're rapidly gaining weight and then you're rapidly losing that weight once you deliver the baby, the skin doesn't always bounce back the way it would if you were younger. So obviously age is a component, but also genetics. There are some people that just bounce back, and other people that it does not bounce back as well. So there's different factors that come into play as to what category you fall into. But it's safe to say that if you have extra skin that ends up creating a fold or is hanging over, potentially like in the belly, then that skin has to be surgically removed. The skin, there's nothing that you can do non-surgically that's going to give you enough contraction to where all that loose skin is resolved. You might get some, but you'll still probably be left with some skin redundancy that's going to bother you. So I think it's safe to say a general rule is if you do have skin that creates a fold or that overhangs, that more than likely you would need to have that surgically removed. So I've been seeing a lot of things on social media talking about, oh, well, if you do special diets or if you take certain supplements that your skin will contract back. If you consider the skin like a rubber band, initially you can stretch that rubber band out and it'll bounce back to its normal shape. But if you have a rubber band that's, super old, or if you just stretch it back and forth a lot over time, that rubber band is going to lose its elasticity. And no matter how much you want it to contract back, it's just not going to have the same recoil as it did when it was a brand new rubber band. And the same thing happens with our skin. We're constantly aging, we're constantly putting our skin under stress with whether or not we're gaining weight or having kids. And then you have the whole genetic component as well. If your parents, developed a lot of wrinkles in their older years, then more than likely you have the same type of tissue quality that's just not going to hold its form as much as you get older. And so all of those things come into play. So I think that in the right person, you might be able to get away with doing non-surgical modalities to try to get some additional skin tightening. But like I said, for the most part, if you do have that extra skin that creates a fold, then more than likely you're going to have it surgically removed. So I hope that answers your questions. If you have any other thoughts and comments, leave them in the comments below.